Director General of the Ministry of Health Dr. Vishwa Mahadeo described the issue as long-standing, affecting the National Psychiatric Hospital in Region 6 for years. Patients are sent for institutionalization by the courts. However, Dr. Mahadeo told the newsroom that the patients oftentimes do not belong at the hospital. The issue is only put forward now after a daring fire and escape by some of those who were at the hospital after a fight broke out on June 5th.
The main issue that we had is a long-standing issue where magistrates send patients supposedly that these persons need to come to the Fort Canchy Hospital, and they are sent to the hospital. The doctors determine after 48 hours that these are not really mental health patients to be kept in the hospital, but they cannot discharge because they were sent with a court order. So we are working on all of that to deal with it, because if they are not mental health patients, they should not be institutionalized there.
Added to that, Dr. Mahadeo said that more than 90% of the patients housed at the mental institution should not be there.
The relatives don't want to collect them because mental health still has stigma attached to it. So relatives don't want to collect them. We send them to the homes of their relatives. They put them out on the street and so it is also an issue of the community, and we need to raise awareness, because actually there are laws that govern these things where because most of these persons who we have there are geriatrics. They're over 60. Some of them have been there over 50 years, right? So these are issues, all these issues we'll have to look at.
Further to this, Dr. Mahadeo said that the report on investigations into the fire at the hospital has been completed and submitted. The next step is for the recommendations to be implemented. This, he added, relates to baseline management and safety issues. The fire had reportedly started following a fight that broke out between 3 male patients in a shielded 4 male admission ward, which housed 31 patients. The matron, along with the supervisor and 2 male nurses, went into the ward, where they saw smoke and heard patients shouting for help. The fire service was contacted and firefighters managed to extinguish the fire, but during that time, the patients left from a southern door and 9 of them went missing. All of the patients are now back at the hospital. Reporting for the newsroom, Vishwa Mahadeo.